Minister, politics and politicians have failed the healthcare needs of the Midwest. As the crisis in our emergency department rages, we have a bad flu season this year, and a flu season we knew was coming because of the data available since the summer from Australia. Minister, the low uptake of the flu vaccine is frightening, and this is something government has failed to address in terms of an information and awareness campaign to urge people to get the vaccine. The vaccine should be free, and it should be universal, and we've been saying this for 10 years, and I cannot understand why we haven't been listened to. This is a proven way to take pressure off EDs, as thousands are going to be hospitalised this year due to flu. And it's also incredibly concerning to hear reports that the enhanced flu vaccine was not obtained for cost reasons. As my colleague Deputy Marie Sherlock said, this is appalling penny pinching, and it will have serious costs for older people and for scheduled care in our hospitals. We know the enhanced flu vaccine outperforms the standard vaccine, particularly with older people, and this is madness given the data we have from Australia. So, Minister, I have 3 questions. As a TD for Limerick and a Cabinet Minister, will you ensure that the health memo at Cabinet next week commits to a new standalone hospital in the Midwest, so option C as well as A and B? Will you account for why you didn't roll out the enhanced flu vaccine? And will you commit to a public awareness campaign to make the flu vaccine universal?
With regard to the flu, you're right. We're worried about the amount of people that could still get the flu vaccine. The vaccine is the best form of protection, to be quite honest about it. There's a lot of people in hospital, well over 3/4 of the people in hospital at the moment with the flu aren't vaccinated. That's a concern. And I'd use this opportunity to remind people that anyone over 60 in the age group of 2 to 17 can get it free, so can healthcare workers. And the HSE have done a lot of campaigns. Indeed, on the day of the opening of the hospital in Limerick, they did a campaign in Limerick, and they tried to encourage people to get it. I would encourage people in the House. I've gotten it myself. I'm from a cohort of people where I'm immunosuppressed. I need to get it, and I would encourage anybody that still hasn't gotten the flu vaccine to please go out and get it.